SA, we follow Monty, who dreams of bringing change to the dental industry.
My dream is to become a dentist.
To be successful in this industry, you need to be patient, calm.
This is how we roll on Made in SA. We celebrate young people of excellence and give them a kickstart on the road to making their dream a reality.
My name is Mandi. I'm 22 years old. I'm originally from Polokwane in Limpopo, but I'm currently residing in Pretoria for the duration of my studies. I would describe myself as a very energetic person. You know, I'm a go-getter. I make everything fun. And I've recently discovered a love for photography. I love photographing nature, like taking pictures of people, you know. The special people in my life, it has to be my friends and family. You know, my family, they are the most wonderful people in this world. Literally the most smartest people that I know, and they've always been there for me, you know. They always make like a difference in my life, and you know, I'm really grateful for who they are and what they do in my life.
My name is Thabo Ngwepe, and Monty is my nephew. Monty ke motho e leng hore ona le thabo o nyaka go itswalantsha le batho ke motho e leng hore le he ke botsa batso motswala ha le khaijedi ya ha le batho ba bang ntwe ete ba e bollang ke hore Monty ke motho wa rata meswaso motho wa rata go itswalantsha le batho motho wa rata hore a fitlhelle dilo tse digolo mo bophelong.
And with regard to my friends, you know, they're most energetic, you know, but down to earth at the same time, you know, they're very optimistic and they always keep me going, so I really like that about them.
My name is Lisiva Orapapo and I'm from Polokwane in Limpopo. And I've known Monty for like 9 years, I think. Yeah, I met him in 2007, we were doing grade 7, yes.
My name is Lebo Pape. I'm from Limpopo, Polokwane, and I've known Monty for 7 years.
Monty is a fun person. He's like a very goal-driven guy.
I would describe Monty as a people's person.
Hona le tshung tsa o fapana tšeo ka di šomišang. Bofokodi ba Monty ke gore o nyaka gore a be a lokologe a die dilo ka boyena ka mokgwa e leng gore o nyaka hona o hopotse ka hona e seng ka mokgwa e leng gore batho ba bang necessarily ba nyaka gore a die dilo ka hona.
Monty's biggest flaw is he's a very impatient guy. I mean, what he wants and he wants it now. What I love about Monty is that you know, him and I we almost grew up together. You know, we have this competitive thing that we have going on where he motivates me to do something and I also motivate him to do something.
The one thing I like about Monty is that whenever he's a very good friend. Like he's a good listener and he'll give you the best advice. He won't try and make you feel better by giving you the wrong advice.
My dream is to fly over the rainbow so high. Okay, no. My dream is to become a dentist. I've always known that I want to be in the medical profession, but I was not really too sure what I wanted to be exactly. So it was when I got to university, when I got into the dental program, that I realized that actually this is for me.
Toro ya Monty ya nyaka ba dentist ke bona ile toro e leng gore o tla e fitlhella ka gore a seta be leng gore o kharameditswe or ka re o kharameditswe ka mo gae o ba o kharameditswe ke go sekolong fela ke ntwe e leng gore o bentse a e bolela go tloa e santse le o moswa a ntse a bolela gore na o nyaka o ithutela dithuto tše tša go ya bongakeng.
Monty's dream of being a dentist, I think it's definitely achievable because like he's already so far almost done with it. And like from where we come from, it seemed like it was impossible. I mean, I feel like, you know what, anything is possible if you actually put your mind to it, and that's what he has done.
For me to get closer to my dream, I'm currently enrolled in a Bachelor of Dental Surgery degree at Fagomahato Health Sciences University. I'm doing my 4th year of study, so that's quite exciting, you know. And also, recently, I've been into an outreach program that goes into informal settlements and tries to help people who cannot afford to get into the dental world and so forth. So that's what I've done so far.
I see Monty reaching his dream of becoming a dentist because it is something which he has been loving for many years.
I think Monty will achieve his goal because he's a hard worker, first of all. And given the fact that we work in the same building, I have seen him treating patients. I have seen how he doesn't limit himself. If he has a question, he will go and ask the lecturer what he can improve on.
I think it's very important to follow my dream because if I neglect it, I feel like I'm going to be depressed at a later stage of my life. For people who tell me that this dream won't get me anywhere, I tell them that, you know what, God won't put you in a position where he doesn't want you to excel. So I believe that he's put me in this particular position to be the best that I can be, and of course I will succeed in it. I think the biggest challenge with regard to dentistry, apart from money, is the fact that it's not perceived to be serious. You know, a lot of people don't take dentistry seriously. Not even like the health sector takes it seriously. So you find that there are a lot of places in rural areas where they're underdeveloped, you know? So you get there, you start working, and you don't have equipment to work. And I feel like that, for me, it's my biggest challenge because I might end up losing my skill because of the undeveloped places that I might work in. Well, I think the best thing that to do with regard to overcoming these challenges and fears is to just increase awareness about dentistry, you know. Go out there, tell people about the importance of dentistry, what it should mean in their lives, and how they can actually incorporate it into their lives.
Monty o tla thusha kudu aga khumana coach wa motho e leng gore aga mo thusha ka mo mentora ka baka la gore mentor wa hayo aga mo tsweletsa pele ka baka la gore e motho a sa khumana mentorship a sa khumana a sa ba exposed to motho e leng gore aga mo thusha a gone o ithuta botse fela o khumane motho e leng gore o na le tsebo motho e leng gore o be ntse a le ka mo lefapheng leo a tseneletse ka mo lefapheng leo a ka kgona gore a o thushe gore gone go kaonefala ka thuto e leng gore o nyaka go itsweletsa.
Monty, good luck with your studies, man. This is our dream. I mean, we've made it so far. I don't think there's anything that's gonna stop us. I mean, big ups, man. Big ups to you, man.
Monty, dude, like, we've come so far. Like, we're just right there. Keep on pushing and growing and becoming the best that you can be. You are already there. We believe in you, and thank you for all the motivation.
Monty has been working hard and in his 4th year of a 5-year degree that will enable him to become a qualified dentist. But first, it's time for him to meet his maiden essay coach and complete his challenge. Today we are getting to know Monty, who dreams of becoming a dentist. Many of his hobbies had to take a backseat while he focuses on his studies. But in the long run, it is all worthwhile.
My name is Dr. Shana Haripasad. I am a prosthodontist. Prosthodontist is basically one of the specialities within the dental field, where we restore your oral health with the use of dental implants, crowns and bridges, etc., as well as restoring the maxillofacial region, which is if a patient loses an eye or an ear, etc., we also restore that. That's part of my specialty. To be successful in this industry, you need to be patient, calm, have good communication skills, because obviously you're dealing with patients on a daily basis, to be able to understand their problems and assist them with it. I love my job. I love everything to do with dentistry, especially when you get a patient who comes in and they're not so happy about their smile or aesthetics, and when you give them the end result, you change their complete self-esteem about themselves, and it's amazing to watch that transition happen in front of you. There's lots of misconceptions, but my top two would be that dentistry is equal pain, which is not true nowadays. There's so much more advanced technology that we can do where that's not true anymore. The other biggest misconception is that it's not as important to take care of your oral health as it is to take care of the rest of your body, which is completely incorrect, as research shows that there's a direct link between your oral health and systemic diseases such as diabetes as well as heart conditions. Today I am coaching Monty, who I'm very excited to meet as he wants to become a dentist.
With regard to spending time with my coach today, I'm quite excited, but at the same time I'm nervous because I don't know what to expect. But in all hopes, I hope that it's going to be a very good day, and I'm just hoping for the best. If it happens that I don't like what's happening, I'll just know that I can, take a different path in life.
Good morning, how are you? Well, and yourself, sir?
I'm well. My name is Mandi. I'm from Made in SA, and I'm here to see Dr. Harry Prasad, please.
You're welcome to have a seat, sir. I'll phone the doctor and inform her that you're here.
Thank you.
Hi, doctor. Monty is here to see you.
Hi, Monty.
Good morning. How are
Nice
you?
to finally meet you. I'm
Likewise.
Dr. Harry Prasad, and I'm your coach for today.
Exciting stuff.
So tell me, Monty, tell me something about yourself.
Well, I'm 22 years old. I come from a very, very loving family, They've always been there for me. They have very strong values, I think some of which they have actually incorporated into me. I'm very hardworking.
It's good.
Always up for a challenge, Yeah, well, sometimes more than others, but always up for a challenge. And I'm currently in my 4th year of studying dentistry.
Okay, so you're almost there.
Almost there, so that's quite exciting. Okay. And yeah, I'm a very, very dedicated person, I like challenges,
Okay,
Yeah.
So you're in the right place today then.
I think I am, so that's who I am.
Tell me, why did you choose dentistry?
Well, actually, from a very young age, I've always known that I want to be in the health sciences sector. I was not really too sure where exactly I want to go.
Okay.
And then I landed up in dentistry, and it was then when I actually found out that I love dentistry so much, I think it's all about making people smile, Well, we have a beautiful smile.
Thank you.
Yeah, so I actually enjoy that, working with people and managing their misconceptions about dentistry,
Okay.
the pain and everything else. So I really enjoy that.
And Monty, are you ready for your challenge?
I was born ready for this.
Fabulous, let's go. My first impression of Monty was that he's very confident, very friendly, able to strike up a conversation, which are all traits that you need in the field of dentistry. So Monty, this is your first challenge for today, but before you start, I would like to introduce you to Yolanda Botha, and she's going to be your clinical educator for today.
Nice to meet you.
Welcome.
Thank you.
So just a quick idea of what you're going to have to do today, thankfully not on anybody's teeth, or mine especially, is to work on this perspex blocks. Okay? So it's imitating the root system of a tooth. So Yolanda's going to train you in all the steps necessary to accomplish rotary endodontics, and then you are also going to actually fill the canal up with the root canal material. So I'm going to leave you in the capable hands of Yolanda, and then I'll catch you a little bit later.
Exciting.
Thank you. Monty's challenge for today, his first challenge for today, was to experience rotary endodontics, and rotary endodontics using the most advanced technology that we have available at present.
What I'll need you to do today is to really concentrate on all the steps that I'm going to do. Okay? Because after this, you will do your own root canal. So you will be very happy to see what I've got to show you today.
Excited, actually. When I walked in here, my first impression is that, I got a bit intimidated, obviously, because I didn't really know what I was supposed to expect from it.
what I've got here is a cordless handpiece.
Okay.
So no more fatigue on a dentist's hand. Okay, so you can feel that.
It's quite heavy though. It's quite heavy.
More heavy than an hour and a half or 2 hours with the hand.
I doubt it.
Okay, then you will also be very happy to learn that an iPad is not just for social media anymore.
Not just for Instagram.
No, we're going to use it to help us do the root canal.
Oh wow, okay.
We will start our treatments.
Okay.
Always 10K fold. And you will go down and you will place your stop. And now you will take your X-ray.
Monty is exploring the latest technology within the dental industry and is like a boy with a new toy. So exciting! Monty is spending the day with his coach, who is helping him master the latest technology. Root canal and getting a crown made has come a long way. Not just for the dentist, but for the patient too.
Number 16, 2%.
Okay. Monty, always keep it comfortable.
Okay.
Always hold it. Yeah, hold it like a pen.
Okay.
You see, you've got much more control. You also don't want to overfile.
Yeah, just about to say that.
Okay.
Smooth file, because we don't want to separate the next file in the canal. No, you need a smooth slide file. Leave it there.
Just wait on it. So it can dry out.
We're happy. You can break it off. Are you happy?
Looks good.
Well done.
You taught me well. That's really, really good.
You were a very good student.
Thank you for teaching me. Taught me very well.
Thank you. So my first impression about Monty was that he's a friendly guy and he's confident, and that is something that I think is very important in this industry, because you're sitting with patients that has got misperceptions and that is scared already.
Hi, Monty. How are you? Good. How was your first challenge?
I think it was quite good, you know, it was very interesting. I think the technology that was used there is, you know, mind-blowing, and I'm actually grateful that I got the opportunity to see that.
So if you're impressed with the first challenge, you're going to be super impressed with your second challenge.
Now I'm getting super hyped up.
Okay, so you can have a seat there.
Okay, thank you.
So first, let me introduce you to Angelique Giel. It's our CAD CAM specialist, Angelique Giel. Okay. Do you know what CAD CAM stands for?
No.
Okay, so it's pretty simple. CAD CAM means computer aided design, computer aided manufacture. So we're basically using a computer technology to assist us in manufacturing an intraoral prosthesis, such as a crown, which is going to be your challenge for today. It's to basically, Angelique's going to train you in how to use the machine to scan a tooth that's already been prepared for a single crown. And that's going to be your first part of this challenge. And the second part is then going to be manufacturing it, getting it milled. That's the correct terminology. This is a completed CAD CAM manufactured crown, and this is what the end result that I'm looking to get from you.
This is too much pressure. Sure it'll go well? Okay.
Perfect. So I'm going to leave you in the capable hands of Angelique, and she's going to train you, and then you're going to do it all by yourself.
Hi, Monty. My first impression of Monty was a very positive impression. He's a very friendly, outgoing personality type, and I feel that he is very bright.
Would you like me to demonstrate to you how this is done?
Please do. I'd like to see how this actually happens.
We have what we call the acquisition center in the form of a computer that we basically capture our digital impressions. And then the software is asking us which one of these milling units we will be using.
Okay, so that's when it goes.
That is correct.
Okay.
And the one that's activated to this acquisition center is the MCX milling unit. So now we need to give it the impressions.
Okay.
All right, like your conventional treatment planning or conventional route of treatment, you would take impressions. We are now going to do digital impressions.
Okay.
You can see it's very relaxed and it's flexible on my wrist.
Okay.
So by supporting your body, you go to the posterior region of the mandible. Now we've given it the image on the lower jaw and our preparation.
I feel that he picked up on the concept of CAD CAM quite easily.
So we need to swap sides.
Okay,
let's go for it.
Okay.
Okay, so now remember what I said about adding the new patient.
Yes.
So where do we go from here?
Go here.
That's correct.
The
And
patient.
then what is the most important information?
The patient's ID.
Perfect.
I think I'm doing reasonably well, you know. I think I don't feel intimidated anymore. I'm feeling relaxed, most probably because the people that I'm working with provided an environment where I can just relax. So I now have an idea of what I'm dealing with and I'm very comfortable with it. Let's flip this.
Okay, Monty, now you can test your restoration on your patient and see if you are happy with the results.
Yeah.
You happy?
So just with this, just needs.
Monty, are you done?
Yes, I'm done.
And how was it?
I think it went well. It doesn't look as bad as I thought it would look with the first attempt, but I think it looks very good. Yeah.
And Angelique, how do you think that he did?
Well, Monty, I'm very impressed with what you achieved today. You followed all the steps like I explained to you. So I'm really proud of what you have achieved by milling your first CAD CAM restoration today. Very well done. If I have to rate your progress for the day from 1 to 10, I would say you definitely earned yourself a well-deserved 7. Okay, Monty, so all the best of luck to you in your future, and hopefully I'll see you again one day in dentistry.
Definitely.
All the best of luck, Monty. Thank you. Bye-bye. Doctor?
The two of us again.
Yes.
So I've been observing you throughout the day.
Okay.
And I'm just going to give you some feedback on what I've observed.
Please do.
Firstly, I can sense the passion in you for your career path that you have chosen. And with you having done procedures which you've never been exposed to before, I think you've done a very good job. And I could see your passion and your enjoyment in doing the processes and learning something new. And that's what dentistry is going to offer you once you qualify. Every day is going to be a learning experience, and that you must just absorb as much as you can to become the best in the industry.
I'm very grateful for the opportunity that has been granted to me. I'm very grateful for the time that you spent, and I think I learned a lot today, and I just hope that, I can take this experience and use it further to actually uplift my career.
My overall impression of Monty, that he appears to be a very dedicated student, very motivated and willing to learn and absorb everything that's out there regarding dentistry. Bye-bye.
I have a brand new perspective with regard to dentistry, and it actually made me fall in love more with dentistry.
Monty, my motivational message for you is to just persevere and go out there and give it your all in your studies. You have the right mindset and the right attitude from what I've seen today to achieve great goals and to become one of the best in the country.
After today, I'm more than convinced that I should become a dentist.